Good day, everyone. Welcome to another episode of Collaborative Connections, a space for sharing and learning, sponsored by the Society for Oncology Massage and the Society for Oncology Aesthetics. My name is Ericka Clinton, and I will be your host for this episode. And on today's podcast, we have Xerlan Deery. Xerlan is a licensed and board certified massage therapist, educator, and healthcare consultant with over 35 years of experience. Throughout her career, Xerlan has held various roles, including working in hospitals as a massage therapist, as an instructor of an S4OM foundational oncology massage therapy course, a continuing education provider, a hospital-based massage consultant, and a founder and owner of a massage school and a multidisciplinary practice. Xerlan's commitment to the profession is evident in her involvement in numerous organizations such as S4OM, the American Massage Therapy Association, and the National Certification Board for Therapeutic Massage and Bodywork. Her contributions to the field of massage therapy have been recognized through various awards, including the Healing Hands Awards from the Why Me Breast Cancer Network of Strength and the AMTA National Mentor of the Year Award. Xerlan currently works at Mainline Health Cancer Center of Paoli Hospital and Tower Health McGlynn Cancer Institute, Phoenixville Hospital. Both are non-for-profit healthcare systems. Okay, I need to take a break now. But welcome, Xerlan, and thank you so much for joining us today. It's truly a pleasure to have you. Well, we should be honored. That is like a serious, serious resume and so many things. I'm like, how does she have time to do all of this stuff?
We didn't have any social media back then.
So
I mean,
you had to just work, right?
yeah, yeah. It's just do the thing. It was
Yeah.
most of the connecting was actually on the phone. So
Wow.
yeah, or in person.
And you did a lot by making those connections. Let's start and give our audience a little bit of information about you. How did you get the opportunity or manifest the opportunity to work in a hospital?
So I'm not sure I manifested it, but when I was in massage school in like 87, 88 in San Diego, I was the problem child. I was the one when they would say things like, you can't massage someone that's pregnant, but they need it. I had been pregnant. I wanted to massage. You can't massage cancer patient that spreads cancer. I would be the one that would remember to say, okay, how does this work? Because we get the biology part and I don't understand the stats. And so my teacher, Dr. Barry Green, he was also a clinical psychologist. And so he had some really good evidence-based skills and logic and such a brainiac. And he would say, you might be the one that figures this out. You might be one of the people that finally figures this out. I'm not going to dissuade you. Just be careful. Okay. So maybe I did kind of manifest it, but I don't know. I really got lucky because when we moved from San Diego back to Oklahoma, Tulsa, Oklahoma, where I'm from, this ad was in the paper and it was from Hillcrest Medical Center and they were hiring a massage therapist for the Women's Center. And it was a full-time job.
Wow.
Wow. Okay, I'll go apply. Now, at the time, the state of Oklahoma had no licensing. Tulsa had no license, had little licensing. It was a massage technician license, and you could get a license if somebody else who had the license signed a piece of paper that said they apprenticed you for 250 hours and you had 250 names of people you worked on and turned it in. Whoa. Or you could just take the anatomy class over at the community college where you dissect the cat. That was it. And so bopping in there with 650 hours was kind of intimidating. Oh, I went to school, silly me. But I kind of knew even in 88 that it was going that direction, that licenses were happening in states and 500, 600 hours and more were actually happening. So I did have that thought and to get a real good education. And, don't cut the corners. Get in there and just do it, do it, do it. And it made a difference. And so
Wow.
when I applied, I was maybe one of the few people that applied that had actually been to school. And that probably helped a lot.
I bet, since
Mhm.
literally you just, work next to somebody for 250 hours.
Yeah.
But thankfully, times have changed. So, first hospital-based position in the 90s or
Yeah.
80s.
I
Ah,
actually I was at the Women's Center, but that was in 89. And by
mm,
1990, I actually had another position over with the behavioral services in hospital. And I was working with they called it the transitions unit. It was
mhm.
geriatric psych. And it was basically the place where older people would be for assessment because sometimes they didn't know what was going on. Did they have dementia? Did they have Alzheimer? Did they have stroke? What happened? So I actually got to work with my very first cancer patient in a hospital with the physician's order in 1990.
That's amazing. That's
Yeah.
amazing.
And what's even more amazing is that patient went out to the West Coast to a certain hospital to have a bone marrow transplant and met Gail McDonald and brought me her card. And so
Oh,
we
wow.
became phone buddies.
Small world, right?
Yeah.
Really, really small world when you do what we do. That's amazing. That's
Mm-hmm.
absolutely amazing. So, talk to us about hospitalized patients. How do they benefit from massage therapy?
Well, I have to tell the doctors about this. And the first time I ever had to speak to doctors, you talk about imposter syndrome because I apologized for being a massage therapist and presenting their CME. But I offered that I would be quiet and that they could just eat their chicken dinner in peace if one of them would come up to the podium, speak in the microphone, and just name one disorder, one disease, one pathology that they treat that is not negatively acerated by stress. They can't.
Mm,
So every single person would benefit. And, it's going to vary with the patients. And so sometimes people get very confused if they hear me say something like, I'm working with people after radiation and they, oh, you can't do that. Well, I'm not working where they're radiated, or I'm working with someone with post-op pain. How do you do that? Well, I'm kind of just distracting them by working on their beats sometimes. You know, it's it's very different than I think people realize, and you really have to be ready to listen to the person and see what they need, see what they want. Make sure you've got that informed consent going on because in some ways the hospital is a little bit more serious, dangerous, dicey.
mhm.
Yeah.
But I think we walk in that room and in some ways recognize that there's a person, not a disease,
Hmm. Yeah.
right? And they appreciate that so much. I had a patient once say, "You walk in the room and you don't want anything from me.
Right.
You don't want any blood. You don't want to know how much pain I'm in. You just want me to feel better in some way."
Hmm. And one of the hospitals I work with, all the name tags have a thing to say be seen. We want to make sure everybody is seen.
Yes.
And there's even rules, and you may see that now at hospitals. It used to be people would be walking up and down the halls and little lights would be on and things would be going off. Now we don't do that. Even I can answer a call or a light because it might be something as simple as they need a drink of water, or
Mhm.
can someone hand them their glasses because they're in there by themselves. And that really helps with the nurses. So they're not scurrying over there thinking, oh, I got to take care of this person. And then it's just a glass of water.
Yeah.
And I
So
think I think medicine is becoming much more human in that respect. and not just including us, but having those type of attitudes and encouraging them.
Yes, making sure people are seen is really important. So let's flip that question around. How do massage therapists benefit from working in a hospital?
Lifelong learning, constantly challenged.
Yeah.
Yeah. And honestly, I mean, I just feel like it's such a honor to be able to serve in that respect. I don't know if it's different. It may be different in a for-profit hospital or a nonprofit hospital, but the diversity is very different than maybe just a private practice or another place that people get massage. I've got to do massage with translators because
Mm-hmm.
there are people that don't speak the same language. And that's really interesting. But also, depending on where you're at, if you're an employee and you have benefits and the stability and the schedule, da 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 da, that's one thing. But if you're contract, you may be a little more money, but you also may have a lot more flexibility. And so, it kind of depends. And I think a lot of hospital-based programs do start with contract because it's a safe start. It's a much bigger deal to try to create an actual part-time or full-time job within the hospital with HR.
Yes, definitely. So let's identify the skill set. What is the type of training and skills a massage therapist would need to work in a hospital?
All of them, every single one of them. You are right next to people that have like master's degrees. And if you utter that you just took, you got your quote certification online in 2 days, they're just going to roll their eyes. Okay. So you're just lifelong learning. And honestly, you don't know what's going to happen because it's never just one thing. So for instance, in the cancer center, one of the cancer centers I work at, cancer has specialties within specialties. So cancer and oncology is a specialty. But then we have senior oncology, and then we have the LGBTQ plus inclusive care oncology, and some may have pediatrics. But you may walk in there and it may be somebody that has this cancer and it may be very simple and may be getting preventative chemotherapy, but they had a knee replaced 8 weeks ago and they're still really sore and there's a little swelling there. Can you work with that?
Right. I always say, like, you work in a hospital, you're MacGyver, the
Yeah.
MacGyver of massage. Just like anything's coming through the door. You have no idea what it could be, and you just are prepared for any opportunity to work, basically.
Yeah. And even if you have access to like the EMR and everything, and you have the whole story, they may tell you something else completely different or an
Absolutely.
addition that nobody else knows because you're the massage therapist. So now they can talk to you about this and this and this.
Yeah, that path, that river of information that
I know.
sometimes it's very clear or very muddy, right?
Yeah.
So if a massage therapist wanted to build a hospital-based program, there's nothing in their, community hospital. How would they go about doing that?
I would say first, there's got to be willingness to be able to do a lot of things, but also recognize where you're at because wherever you're at and wherever you're practicing, I don't think a lot of people realize that they're already on a healthcare team. If they have people coming to them that are medically involved, they're on a healthcare team. They may not know the other people of the team. They may not have even discussed that. They may understand that this person probably has an oncologist and da 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 da. But just that thought of, wait, I'm on a healthcare team. I need to recognize and appreciate and respect all these other people that are working with. But I also might want to give them 3 cards and say, would you please make certain you tell your oncologist that you got a massage from me this week? If you have a nurse navigator, would you please let them know that I'm out here and I'm serving you? If they've got any questions or anything, I'd be more than happy to answer them. And it's things like that that are not pushy that really make a difference, especially if that person, they keep seeing the same card.
they start to be familiar with you. They
Yeah.
realize that the patients that are coming to you have really good outcomes and benefit from your work. And then I think sometimes you get these magical invitations.
Right.
Come and, do massages for Nurses Week or speak at a health fair or something. And all of a sudden, you're kind of recognized as part of that system.
Mm-hmm.
And then, as I always like to tell people, and then somebody will probably find some money to pay.
Yes. And while healthcare may seem very challenged, and a lot of times people are like, oh, we don't have any money for that. Sometimes they do, and they have different committees and different funds that they may be able to utilize that with. But also, one of the things that a lot of people don't pay attention to, and I tell people, no matter where you work, you're working for yourself. Because some of the biggest mistakes is people get this wonderful opportunity and they're handed a hospital-based program and they've got a whole integrated team and they're all having tea, but they're not marketing, they're not reaching out, they're not trying to make themselves available and working as hard as they would if they were in their own place trying to make the rent, so to speak. And so we do need to pay attention to that. But also, one of the things that every hospital-based program may be looking at is return on investment. How much are they investing? What is their return? And while that return might be invisible and not really have a dollar sign in front of it, it's got to have a lot of value. And as we see things shifting with massage therapists in hospitals in VAs and different insurance companies saying, oh, yeah, we're going to maybe cover this, and more people getting opportunities to work in hospitals and rehab centers. I notice a lot of massage therapists are becoming an ANDA, such as a physical therapy assistant and a massage therapist. That's another new person that's going to be on the healthcare team with you too. And they're going to start looking at these things and need to validate what is that return on investment. How much are people going to pay for the massage? How much are they going to value the massage? And it's going to be different because while massage therapists out in the world may want to go, yeah, we need to see you for an hour or try to get an hour and a half or add this or add that, and da 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 da. When you're in the hospital, it's like you're minimizing because there's so much going on with these people. They can't take that full hour, sometimes not even the full 30 minutes. And it's also not just go lighter because that ends up boring like a human petting zoo. And so there's a lot of skill, a nuance that's going on as we make adjustments with these techniques that we're doing, standard massage techniques.
No, and I like what you said about the kind of understanding, because at the end of the day, unfortunately or fortunately, a hospital is a business, right? And so they have to understand the value you bring to the hospital. They know the value their surgeons bring. They know their value the nurses bring, even the radiology techs. They know the value they bring. They don't know the value of their massage therapist necessarily.
Until they start hearing it from their patients.
Exactly. And that's really the feedback that's going to be helpful.
Mm-hmm.
I also found when I was able to have the conversation about risk with a lot of information and confidence about how low risk massage is, right? And dispelling all those myths, which it's amazing to still talk to medical professionals who think massage spreads cancer. Like, oh God. But there's still some of those folks out there. So being able, I think, to have that conversation and understand, the risk the hospital will take by employing you, which is very little, and being confident enough to say, there's data to look at, there are studies to review, there's new information, right, that says that we are much more beneficial than we are risky. I would say it's also now besides those two questions, would you say developing a hospital-based massage program is fairly straightforward? Think about design of your sessions and how many people you could work on, which is never enough in a hospital setting, right? It's like thousands of people in the hospital, you're one person or maybe a team of 5 people. And even if everybody gets 15 minutes, you're missing something, right? So,
Well, but sometimes you don't realize how much you can do in 15 minutes because, like I said, a lot of them really can't take the longer session or a session that's more confrontive to the body. And so, it goes both ways in that respect. But being able to be really specific, uh,
mhm,
understanding, understanding that informed consent means that I'm going to be completely vaccinated and they're going to feel safe in the hospital because they're going to know that I had to go through this huge gauntlet.
mhm,
And, we even have titers where they'll do the blood and titers to say, oh no, you need this vaccine needs to be boosted now. And yeah, because we're trying to keep them safe and we're trying to also use that informed consent to let them know what exactly we're doing and how we can help and that we can help them sleep. We can help them with the fatigue, which fatigue needs a different name in the hospital because it's really a lot more than fatigue
yes.
and neuropathy and the pain management. And when the physicians and the nurses start hearing back from the people about that being successful, when somebody goes to the trouble of, we didn't get the massage therapist's name because we didn't think of it in the moment, but mom had the best sleep she's had in months. What was her name? Where is she? How do we find her? How do we get her back? Da 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 da.
Mhm.
It's things like that that can be tipping points for people.
That impact can be huge, even in the smallest framework of time in a hospital-based situation. Let's talk about kind of you as a practitioner in a hospital system.
Okay.
What are some of the challenges that you face working in a hospital?
Well, sometimes finding a place to work because it's easy if they say, "Oh, you're in the infusion center," but then if you need to work with someone that's in radiation and you need to kind of work with your colleagues to figure out which exam room you can use, or are you in the waiting room, or did you just modify a whole storage closet? It can happen, right?
Mhm.
And yeah, I was really lucky because the first two hospitals I worked at, they did full hospital orientation for me. But a lot of people don't get that. So they don't know how to make the beds go up and down. They don't know how to use the chairs. They don't know how to get out of the way of all the lines and plumbing and electronics and stuff. And I think that's really unfortunate in some ways. And so that can be a huge challenge for people. And then when you have a room, sometimes somebody else designed it and somebody else who really loved massage and loved their massage therapist designed it. And it's too small, or you're sharing it with an aromatherapist and there's no window and there's no airflow happening, or the table is like, where did they get this? And there's I've got really frail people coming in here and I don't have a step stool and it's not a hydraulic. And so honestly, it's things like this and some of our experience as expert witnesses that play to that when people are thinking of having a hospital-based program and starting an being challenging us is like, yeah, it's a challenge because a lot of times people don't know what they want. They want that word, they want the star, they want, we have this. They actually don't know what they want. And that's where the consultants really can help with hospitals and help them, create a very good space, safe space, and help them actually create a program that is not just safe, but very effective for their people and for their community. And I think it does make a big difference in their community. Their community knows that there's massage therapists there, there's somebody there that's going to hold space for them and see them and take time for them and do something that has nothing to do with having to do medical stuff in that moment.
And
Yeah.
that's so interesting as a hospital consultant, right? You come in and really help them make the best hospital-based massage program they can, right? And you provide them with the information about space and allocation and scheduling and probably everything that they need so that they can integrate that massage therapist effectively. Because, yeah, sometimes you're literally like, well, I'll just go behind this door and work with this person in the smallest space possible because I have a little bit of privacy and enough room to lift my arm.
Yeah.
Well, thank you so much, Xerlan. This has been a really great talk. I'm so glad we got to pick your brain about this very particular topic, which you know a lot of and have a lot of experience in. And we at Xerlan love you dearly and are so thankful that you are an educator, regional champion, and support our group as much as possible. And I love that you're still doing this work after 35 years.
I love it. It's kind of like my semi-retirement has become more than I thought of it. But when you love doing what you're doing, it's not work anymore. It really isn't. Even when I have to get up and I'm reading research at 6:30 in the morning, it's still okay. It's great.
And that's an amazing way to start the day. I hope you have coffee.
I mean, the thing is, there are thousands and thousands of massage therapists out there that are ready to make a difference in people's lives and willing to make a difference in people's lives. And I so wish that oncology massage was just part of every single school and that they had that just from the onset. Because honestly, when they graduate and they go work somewhere, someone's going to expect them to be able to do it. Yeah.
So we've got to really get that as part of the discussion and part of the curriculum in schools. They take pathology, so let's just have an oncology module so that they can be safe.
Mm-hmm. And we have a lot of people involved in the Society for Oncology Massage and involved in hospitals and the Society for Oncology Massage that are ready and willing to be mentors, that are ready and willing to teach. And so it's going to grow.
Yes. With all of our hard work and sweat and tears, we'll get there. We'll get there. But thank you again so much for taking the time. Really, really enjoyed speaking with you.
And thank you, Ericka.
All right, collaborators, have a great day. And I hope you enjoyed today's podcast.